Jody Hager and Christy Fogarty have graduated as advanced dental therapists, and they're eager to take their skills to areas of Minnesota where dentists are hard to find. Hager plans to work as an advanced dental therapist at a clinic in the small rural town of Madelia.
We have patients that drive 2.5 hours to access care because they can't find a dentist from the South Dakota border east. They can't find a dentist until they get to Madelia that will actually take the Minnesota healthcare program.
Okay. And then he's going to be a board patient for you, Christy?
Yep.
Okay. Yep.
We know in outstate that there's a problem. We know that in the inner cities there's a problem accessing dental care, but I was very surprised at, even in the suburbs, how much there is access to dental care problems. And in the suburbs, there almost seems to be a shame about it, that if you don't have dental insurance and you don't have money to just go to the dentist, then a lot of them just very silently go without treatment.
Open, please, Davian.
Access to dental care remains a major problem across the country. More than 16 million U.S. children go each year without seeing a dentist. Minnesota has more than 468,000 residents who live in areas that are federally designated as having a shortage of dentists.
Class 1, left cuspid, class 1.
Children with poor dental health often grow up to be adults with poor dental health, so they have trouble getting and keeping a job. But also, if you don't prevent problems, they become more expensive, and it drives up your Medicaid costs, and it drives up overall health care costs.
Keep it axial with a
Yes. Keep your...
Minnesota's universities wouldn't be training dental therapists had the state not passed a law in 2009 to license new types of providers. Kenton Johnson is one of the Minnesota dentists who publicly supported passage of the state's dental therapy law.
I looked at the comparison between physicians and when nurse practitioners first came on the scene. People weren't sure where they'd fit in, how they'd be used, and I've talked to friends that are physicians and they can't imagine life without nurse practitioners these days. The dental therapists can fit into offices in different ways, different locations, whether it's the main cities or whether in greater Minnesota.
The Advanced Dental Therapist program has set high standards for training practitioners.
And we're talking about educated dental health care providers, experienced providers. They have to have over 2,000 hours of experience and advanced training before they even take the first course.
I myself have done over 200 restorative procedures. By that I mean fillings. The experiences that I've had in this clinic I think are going to be extremely reflective of the type of population that we are going to be working on. We see people come in who have 30 teeth in their mouth and need 20 fillings.
Supporters of the law believe that over time, most dentists will recognize the valuable role that dental therapists can play to improve access to care.
Dental therapy isn't the silver bullet, it's one tool in a big toolbox to helping everyone have access to dental care.